Hello guys, Assalamu alaikum. My name is Muhammad Ghaznavi and I'm one of the OET trainer with this M&M Institute. In this episode, we are going to discuss about a discharge letter, how to write this letter, about the template, the format and the selection of the case notes. Everything will be discussed. So, if you can see on the screen, first of all, whenever you receive the case notes, you just have to go to the bottommost part. So, I already have highlighted something for you, but you can see here on the screen, we are writing this letter to the local doctor. So this is a letter of writing for medicine and we are writing this letter to the local doctor. So one thing that you have to keep in your mind, if you are writing this letter to a local doctor, important thing is that he know the past medical and social history. So it should not be included in the letter. So anyhow, whenever you have the task, first of all, you should go to the bottommost part and you need to read this task carefully. And I can read it here. Write a letter of referral to Mr. Johnson's local doctor, it means the GP, and update him on her condition following her recent surgery and discharge from the rehabilitation. So what I can learn from this line, that this letter is being written to the general practitioner, as the patient had some surgery, we don't know for sure at this moment, and he was in the rehabilitation. After the rehabilitation, he is ready to be discharged. So importantly, we can see there this part that is on the screen, as you can see right now. Yes, here. Now this part is the focus. Here, this part is the focus of writing. So we can see that at the time of discharge, we have discharged this patient with nursing assistance, including the personal hygiene, home care. Then there is some mobility assistance. Then there is a guideline for the medication, like what are the medicine dosage. And most important question at time, students do ask this question, that in discharge letter, should we have to write it down the dosage and the frequency? Yes, indeed, it's very important. If you are going to miss this dosage and frequency, it would be a very negative point in your marking, and to the point that you might not be able to pass the exam, because it's related to selection of the case note that you can see the previous lecture we have covered on the selection. Anyhow, so the medicine guidelines followed by the advice to see the local doctor for the repetition of full blood examination in INR. So we know, at least after reading this task, that why are we writing this letter, and this discharge plan has to be followed. So now we can zoom it out and we can see the important thing are. So when we can start reading the case note from here, where the case is starting, the patient is 81-year-old woman who recently had a total right knee replacement surgery, right, on this date, and she is being discharged today, whatever the date is today. Normally, one more question that I would like to add over here, students are concerned about which date to be written on the exam day. As you can see, these are the past papers or the samples. They are following their own date. So mostly we do consider the last visit date as a today's visit date when we are writing these samples responses. However, in the exam, when you receive the case notes, these days they do mention assume today's date to be. For example, if your exam is on the 11th of November, when you will get your question paper or the case notes, you can find the date, assume today's date to be, for example, 3rd March 2023. So you have to consider that date as a today's date. Anyhow, the name of the patient, then address and widowed is not important. As you can see, it's been a big cross on that part. It's not important in here. So still, for your understanding, I'll just go through this one. Patient has aortic valve replacement and pacemaker is not important. Patient underwent this osteoarthritis surgery is not important, right? So basically, as you can see that, although it's a big cross over there, but for your understanding, so that you can see the case, that what are the relevant case notes and what are the irrelevant case notes. So I will go through the case notes point by point so that you can better understand about the selection of the case notes and why we are not writing this thing in the letter. So you can see aortic valve replacement and pacemaker. Despite the fact you might be confused because we are requesting for the full blood examination, and with reference to that, patient is having this history, we will see that okay, it's very important, but GP already know this information. There is no need of writing that information in your letter. Followed by this osteoarthritis, let's say since 2011, That was the reason we had referred this patient to the surgeon for the right knee replacement surgery. So no need to mention about this thing, which is totally irrelevant. These are the examination and investigation being done before your surgery. Again, at the moment we are standing on the discharge day, so it's again not relevant. These are the regular medicine, paracetamol, warfarin, and blah blah blah. Again, there is no relevance to write it down, these medicine, because we are writing back to the primary care physician. Similarly, widowed from 1986, live alone, 4 children. It might be a point of concern for you. Oh, this is a discharge letter, and we are writing this letter to the GP so that he can manage this case, so he must know about the social history. But again, I'll repeat the same point, that this social history is being known to the GP, so there is no need to mention. So one point that you have to take in your mind, whenever you're writing a letter of discharge, 99.9% of the time your social history will be totally irrelevant, right? But I have left a margin of 1% because at time there could be a self-referral. At time the patient could admit himself in the emergency department. At time the patient will, not being referred by the GP, but he just, he was self-admitted in the emergency department. So there is a possibility that there might be some information that is missing from the GP's notes. Anyhow, so in broader spectrum, this history is totally irrelevant that we discussed with you, right? Anyhow, afterward we have the ward stay. As you can see on screen, it's totally a ward stay. So we will be confused when we are selecting the case notes that which information to be written and which should be omitted. Mostly candidates, they are quite concerned about the number of words, and they start writing the ward details, and they would write each and everything in the ward stay. However, in the ward stay, you just have to summarize to give an overview. So when we read this case notes, here you can see the vitals, the BP, the pulse rate, temperature, circulation was normal and increase on the pillow. This is an eventful thing, the blood transfusion, and then we have some medications. So in general, when we can see there, let's say it's a pain, like analgesia for the pain, all right, and then we can see that wound is improving. Warfarin, we are starting again. Then Claxine, we have to change the dose, then start again the oxycodone. So these are simple ward management, a simple process of ward recovery that we can do for after the rehabilitation, after the post surgery. So what we can see that whatever things are eventful, we just have to write it down, those things, and whatever things are uneventful, we have to omit. I'll be showing you the sample that has been written by the M&M, and so that we have an idea about that. So in this letter, let's say BP and all these things can be written just in simple word, either vitally stable or he had uneventful ward stay. Afterward, you can see this is again the ward stay. We will be covering this thing in the summary form. As you can see that they are just managing the dosage. Sometimes they have to increase the Claxine dose. At times they are starting the warfarin, or at times they are stopping some medication. Let's say Claxine has been stopped. So it's a simple process of the ward. As soon as the patient is improving, accordingly they are managing the different dosage of the medicine. We will be concerned about the medicine because you can see we have the same guideline of mostly the warfarin or oxycodone. Again, it's in the discharge plan. So anyhow, but in the ward stay, it should be written in a summary form. We have not to expand this thing. Followed by the rehabilitation. Now rehabilitation is the point when you are going to discharge the patient. So we have to write it down, let's say in summary form, but comparatively from the ward stay, it would be written much in expansion actually as compared to your ward stay. But again, if you can see in detail, he was stable. He was using these devices, let's say mobility, he was using frame, and then exercise was a part of the rehabilitation. Then you can see the value of INR, then you have decreased the, you can say warfarin as the patient was improving. In short word, you can see that now the patient is being discharged from the hospital. So how can we write it down in letter format? So you can see beside the address, we have not covered this part in this class. We'll show you in some other lecture as it's been covered in the basic lecture of the writing. So from this part, you can see there, this is the introduction. We can write it down, the reason of writing clearly. Like I'm writing to update you regarding Mr. Johnson, who has undergone a successful right knee replacement. So the message is clear in the introduction, and we can also write it down for further follow-up. But here in the introduction, as you can see on the screen, it's written clearly that a patient has a successful right knee replacement surgery. So no need to mention anything else beside that. Afterward, you can see this is just a brief overview. What is the brief overview? The rehabilitation program focused on the patient mobility. You can see that we have not written in detail about each and everything. We just have concise in one line. The ward and rehabilitation program focused on patient mobility. Her stay remained uneventful, let's say for both ward and rehab, apart from this low HB that was the event in the ward for which we had done the blood transfusion, right? Followed by the rehabilitation program, whatever we had included in the rehabilitation, we had covered in this part. So you can see this paragraph was the summary of your ward stay and your rehabilitation. So we have written in a very concise manner. Afterward, we have to expand the discharge plan. His wound is exposed, we are adding in the present tense with no cardiac issue. Therefore, he has been discharged with home nursing assistance with special focus on home care. We just changed the word and personal hygiene. And then we had given a picture that was not written actually over here. We had given a picture over here. She has been becoming independent. So this sentence we are using in the present perfect form so that we can save the word in the rehabilitation, and we are writing this line over here. Her transfer to the ward as now she can walk. So basically we had given impression to the examiner that since ward he has an progressive improvement. That's why we can write down she has been becoming independent in her mobility, and now she can walk with the help of stick or frame as per need basis, and she can take shower with a minimum help, right? Then we can also incorporate about the exercises that the list has been provided in the rehabilitation, followed by the we can say medication. We have written the medication with dosage and the frequency, and then we can write it down the conclusive paragraph. Like, you are requested to review Mr. Johnson after 1 week, as we are requesting to the GP, and please repeat her full blood examination and INR in view of her. This was the last HB value and INR value, right? And then the closing remark: please do not hesitate to contact me if you have any further queries. Yours sincerely. So this was a brief lecture that we had covered in today's class. We had discussed about the discharge letter, and in coming class we will be discussing about a discharge letter but for nurses. So stay tuned with M&M. This channel will help you to pass your exam. Thank you.